Bering Strait School District has been working with Norton Sound Health Corporation, Division of Behavioral Health, and the Special Education Service Agency to develop a link between schools, parents, and Norton Sound Health Corporation when there are behavioral health issues that students might be experiencing. The following is a diagram of the process that should be followed when someone, staff, or parent express concern. The principal is a single point of contact to address the concern, whether the concern is a chronic but non-emergency concern or emergency concern. Always the parent should be notified as soon as possible, and this would be done by the principal, who is a single point of contact. Schools should use their school-wide discipline and behavior support plans, as well as use the solutions team to address chronic problem behaviors, like attendance problems, behavior problems, work completion problems, or academic achievement problems. Hopefully the students' behavior and grades will improve. If they don't, and the behavior problems persist, then the principal has the option of providing information on village-based counseling services through Norton Sound Health Corporation. Schools then can facilitate referrals to the village-based counselor, meaning working with the parent on the referral process if a release of information is signed. If there's an emergency that's identified, it is a whole different process. If there is an emergency concern identified, this flow is used. Emergency concerns include suicidal or homicidal thoughts or behavior. There's also crisis response protocols within the school district, and your school should have them on site if there's a suicide threat or if a student's behavior is threatening to others. Remember, in emergency situations, a release of information is not needed to contact health services or law enforcement. The first person that should be contacted if there's not suicidal or homicidal ideation or thoughts or behavior would be the village-based counselor. Second would be law enforcement, such as the VPSO or Village Public Safety Officer. Third call would be the health aide. Here are the contact numbers for Norton Sound Health Corporation. Parents can also access the Educational Transition Support Project at CESA when their child is at imminent risk of leaving a village for psychiatric placement and treatment, or if a student or youth has a past history of leaving the village for such reasons. Contact information for the Educational Transition Support Project is below. Remember, a release of information would need to be signed by the parent to allow communication between the ETSP, the school, and other agencies that might be involved. And this is a non-emergency situation.
BSSD schools have access to a wide variety of multimedia materials from the PBIS Center and the Special Education Service Agency. Some of the titles deal with youth suicide prevention, managing threats, understanding behavior, diffusing anger and aggression, managing non-compliance, and bully prevention. There is also a wide variety of text